Welcome students to chapter 4, which is on tissues. So yet again we are moving up a level in the biological hierarchy. So a tissue is a group of cells fairly similar in structure that basically do the common function. Like they work, a bunch of cells that work together to do kind of one thing. So there are kind of 4 major types of tissues, and so we're going to go through kind of each of the kind of major categories, looking at the different tissues, looking at what kind of characteristics they have in common, and then also looking at all of the individual tissue types themselves. And we'll also talk about some of our mucous membranes and our serous membranes, and we'll also at the end talk about tissue repair.
Since all of your organs are made up of tissues, a thorough understanding of tissue is required in order to understand the structure and function of body organs. In this chapter, you'll learn about the various types of tissues, and you'll also learn about tissue repair. As a healthcare professional, it's very important for you to understand tissue repair so that you can treat and monitor any tissue damage in your patients. For example, one common type of tissue damage nurses encounter are decubitus ulcers, which result from a continuous pressure on a certain area of the body. The most common decubitus ulcer you're likely to encounter is a bed sore, which usually occurs when a patient has been lying in one position for an extended period of time. The constant pressure restricts blood flow to the area, which damages the tissue. This is a common problem with diabetic patients, since their blood flow is typically already impaired. This means that their wounds may heal more slowly or not heal at all. Treatment of bed sores always involves moving or turning the patient to take the pressure off the wound in order to encourage blood flow to the affected area. Restoring blood flow is extremely important to tissue repair and vital to the healing process of a bed sore. Understanding the process of tissue repair is crucial to treating patients with bed sores and other types of tissue damage.
So as I mentioned at the start of this, there are 4 primary types of tissues. We have epithelial tissues, which are our covering and lining tissues. We have our supportive connective tissues, which ranges from kind of the nice hard bones that make up our skeleton to the blood moving through our blood vessels. We have muscle tissue, which is primarily concerned with producing some sort of movement, not only kind of the gross movement of our body as we walk around and we talk and we dance and we play sports, but also the movement of food through the digestive tract, the contraction and pumping action of your heart. And then, of course, we have our nervous tissue, which is kind of our control, kind of regulatory tissue. So the tissue of our brain and our spinal cord and all of our nerves that go out into our body, that allow the brain to kind of function as kind of the boss of our body. So nervous tissue, brain, spinal cord, all of the various nerves. Muscle tissue encompasses everything from the muscles attached to our bones, muscles in the walls of the digestive tract and the urogenital tract, what we call our hollow organs like our blood vessels, the cardiac muscle of our heart. Then we have all kinds of epithelial tissues, kind of the boundary tissue, does a lot of absorption and secretion, kind of anything moving into or out of the body has to kind of pass through an epithelial tissue, so it's kind of lining all of those hollow organs. Glandular tissues like the pancreas, secretory tissues, of course our skin. The epidermis part of our skin is an epithelial tissue. And then connective tissues are the ones that kind of have the widest variety in terms of structure and function. They're all our supportive protective tissues, kind of binding other tissues together, hence connective tissue. But there's really a huge variety in terms of our connective tissues. It's everything from kind of soft padding tissues like what we call fat tissue and areolar tissue, to the tendons that connect our muscles to our bones, to the bones themselves, and to the blood moving throughout all of our blood vessels. So there's kind of a huge variety in terms of connective tissues. So this chapter kind of focuses on each of our 4 different types of tissues, starting with the epithelial tissues, then the connective tissues, and then the muscles and nervous tissues towards the end of the chapter. And then there's a little bit about membranes and tissue repair. And that's kind of where we're headed with this chapter.